to Paul's Explained. I'm Paul, and all we're trying to do here is explain original articles to the general population. What they mean, kind of break them down in a setting you can understand. That's all. All right, for copyright purposes, I will state that I did not write this article. I'm not involved in the writing of this article. I didn't do any of the research. I'm not trying to promote psychedelic use in any way. This is just about the data. I'm going to try to take myself out of it as much as possible. And once again, these videos are for 18 plus. So if you're not 18, get lost. Okay, so before we jump straight into the article, I will give you the title in just a second here. I do want to make the difference known between original articles and review articles. Review articles, they are, in comparison to original articles, they are much, much less. A lot of times you'll only have abstracts. It's not a lot of data going on, maybe just an abstract and like a small conclusion there. Original articles are new to the subject that we're talking about. So in this case, we are talking about psilocybin use for personality changes. This is the first time that this has been brought up in the realm of psilocybin. Therefore, it's new original articles. In original articles, you have some sections that the review articles do not. So you have your abstract or intro, then you have your methods, results, and discussion. And the discussion and conclusion kind of go hand in hand in a lot of these things. So once again, I'm not really trying to stress you out here, just trying to give you a brief description. What's good about original articles is that they give you a really full, in-depth view of how exactly the clinical trials went, how they did them, the results that came out of them, and the discussion section is how can this contribute to the larger conversation about, in this case, psychedelics. But original articles can be about any topic, same with review articles. So original articles, very in-depth. Review articles, not so much. All right, let's get right into it. All right, welcome to Paul's Explained Episode 1, and today we are talking about, quote, the effects of psilocybin therapy on personality structure. So this is a really interesting article that came out in May 2nd, I think, May 2nd, 2018. So it came out in 2018, about 4 years old, and it was published by Erritzoe et al. So I'm probably butchering that name, but this article is available on Google Scholar. You know, if you've ever used Google Scholar before, go to Google, type in Google Scholar, it'll pop up. Any topic you want, search for it, and it'll come up with articles, original articles mostly, some review articles, but there will be data about that certain topic. There's a whole slew of studies on there, and I suggest that you kind of explore that. I will say, if you really want the best experience out of this, you should bring up the article for yourself, which I'll try to post a PDF or something in the description so you guys can actually follow along. That's if you want, but that's probably the best way to learn here. Treatment-resistant depression will be or predicted to be the #1 global burden of disease by 2030. And it's currently at number 4, according to this article too, so with that being said, treatment-resistant depression is, to them, one of the top priorities in mental health at the moment. So that kind of gives them the grounds for this research. Why is it so important? And why things need to kind of be sped up in this way to search for other options. So then they talk about a few other points. They talk about how there has been decades of suppressed research from the 50s and 60s, and they talk about DMT, LSD. DMT is dimethyltryptamine. LSD is lysergic acid, I believe. Maybe I'm saying that wrong. And they talk about psilocybin as well. But basically they're talking about its uses for treatment of things like addiction to tobacco, so nicotine, or alcoholism, or OCD. They talk about major depressive disorder, and of course treatment-resistant depression. Those are just to name a few. Like, those are the main areas that they want to study these drugs in, and kind of develop conclusions about how these drugs interact with these certain illnesses. All right, so moving on, they talk about how this is the opposite, basically, of the paradigm that we have now, whereas people who are depressed, who are diagnosed by a doctor as moderately, severely, very severe, treatment-resistant depression. Obviously, there's a whole spectrum of depression. They talk about how it's the opposite paradigm. So when you're given antidepressants to treat your depression, in this case today, you're given pills daily or weekly that you take. And it's a long-term thing. You need to take these for the rest of your life, and that's kind of implied. And it's the opposite with psilocybin, because according to this article, you may only need a couple of doses to actually see a change in personality, which is kind of what they're trying to hint at here. Really interesting opening section here. This is great. Moving on, they do, however, go into the benefits of normal antidepressants, how they decrease neuroticism, increase extroversion, increase conscientiousness, and agreeableness remains the same. Basically, those are personality traits that we'll get into a little bit more, because that's what they're talking about, personality structure of how psilocybin might change that. But without further ado, they do talk about how the things we are using today are useful. In their case, they're just trying to find something that might be a little bit better. But the goal of this study was to see if psilocybin therapy, coupled with therapy support, so psychological support in this case, can modulate personality parameters in treatment-resistant depression patients. So if that's a little bit confusing, that's all right. It'll make more sense as we go. However, basically they have psilocybin, the active ingredient in magic mushrooms or shrooms, which I don't know if you're familiar with them, but they are a new therapy. People are starting to come around. There's a lot of data back in the 50s and 60s, as I said before, kind of got suppressed, and now it is coming back into the light and has been back for probably like a little while, maybe just under 10 years. So this stuff is really cool, really interesting, and they want to see if therapy support coupled with psilocybin can treat treatment-resistant depression, which, I mean, if you look at the term treatment-resistant depression, that's kind of insane that there might be some sort of use to psilocybin in this. Moving on to how they identified participants. So basically they went through, this study was 20 people. So 20 treatment-resistant depression patients. I believe there was 2 who were considered moderately depressed. But basically the inclusion criteria for the study was that they scored 17 points or higher on the QID scale. QID scale, if you're not familiar, I'm assuming you are not. It's the Quick Inventory of Depression Symptomology, so QIDS. And basically it goes through a whole slew of topics, and you have a point scale on your right, subjects on your left. So you go through sleep onset insomnia, mid-nocturnal insomnia, early morning insomnia, hypersomnia, mood, appetite, weight, concentration, decision-making, outlook, suicidal ideation, involvement, energy, psychomotor slowing, and psychomotor agitation. And so you have a 1 through 3 or a 1 through 4 scale of how severe they are. So for example, for the first one, sleep onset insomnia. Takes at least 30 minutes to fall asleep, less than half the time. Number 2 on the point scale would be takes at least 30 minutes to fall asleep, more than half the time. And the most severe one is number 3, takes more than 60 minutes to fall asleep, more than half the time. So they have these already diagnosed treatment-resistant depression patients, and they give them this QIDS questionnaire. And the goal of this is to have a baseline. How depressed are they according to themselves? Another part of the inclusion criteria was that they needed to have 2 courses of antidepressants before this, so to prove that they were actually resistant to treatment. So they had to have, I believe it's 2 courses of 6 weeks of antidepressants, and to have no improvement. All right, next up after the inclusion criteria, we have the exclusion criteria. So we just got done talking about the inclusion, so who can be included in the study. Now it's about exclusion, so who can be excluded from it. For example, they didn't take people who were previously diagnosed with a psychotic disorder, and also they excluded people with an immediate family member with a psychotic disorder. I believe this comes up in other studies because it's a factor that needs to be controlled for. and the people who have a psychotic disorder are at higher risk for probability of a psychotic break during these psychedelic experiences with psilocybin therapy, DMT, LSD, I believe MDMA, and probably a few others. But it's something that they looked out for, which is awesome to see. That's obviously something you want out of this kind of research. You want your participants to be safe, and you want to get the as best data as possible. After the inclusion exclusion criteria, we have the study procedure, how exactly they went about getting their results. Okay, you want to look at these. You want to look at how the study procedure goes to get a sense of how other data might be done in the future, how other studies might go about getting similar data or data that can help the subject. So let's begin here. So they started off with a detailed mental and physical health examination of the participants of the 20 that they selected. Obviously, they have treatment-resistant depression, but they did do urine samples, EKG, blood tests, breathalyzers, and this is just all for baseline assessments. You want to see how your participant is before, and then you have your intervention, which in this case is the psilocybin treatment, and then afterward they give them the same baselines and they do a whole thing. We will get into that. So let's get into the meat of the study here. So session 1 with the participants, after obviously they've been cleared, they've been included in the study, there's no major concerns with the participant, they have 2 sessions, okay, and they're a week apart. So the first session is 10 milligrams of psilocybin, oral capsule that they gave the participants, and with a week passing in between, then they gave them the second session, which was 25 milligrams of psilocybin. However, during this therapy session, they had 2 therapists in the room with using a non-directive approach to being supportive. Essentially, they're kind of in the background, but they want to have the participant kind of take the reins on their own experience. They don't want to be too involved. They did have headphones on with music playing. I need that playlist, whatever that playlist is. I need that playlist. But this is all to give the participant the best experience possible. And they said, quote, they wanted mostly uninterrupted introspection for the participants. So that's something that they prioritized right out of the gate, and I think it served them well. We're just about done with the methods section. However, we want to get into the personality assessments of these individuals. Okay, how exactly did authors come to the conclusion about all these personality traits if they don't have a baseline? That's what this section is. So they did test them on things like neuroticism, extroversion, openness, conscientiousness, and agreeableness to begin with. Neuroticism is defined as anxious, insecure, and emotional. Extroversion is described as sociable, optimistic, and talkative. Next up, we have openness, which is curious, imaginative, and creative. Conscientiousness, hardworking, ambitious, persistent, and agreeableness, good-natured, cooperative, and helpful. Now we are on to the results, which is the meat of the study, and to be honest, the most important part. Along with the discussion, they go hand in hand. So let's jump right into the results. 90% of the participants at baseline qualified for severe or very severe depression, which, like I said before, is a QID score, the depression symptomology score of 16, greater or equal to 16, and then moderate was 11, like we had said, 11 or less, basically. And what they found, actually, one of their first findings was that 3 out of the 5 categories that we had talked about, neuroticism, extroversion, openness, conscientiousness, different things like that, 3 out of those 5 categories actually significantly changed. So what you have is a decrease in neuroticism, an increase in extroversion, and an increase in openness. Conscientiousness actually was borderline, was borderline significant, however not clinically significant in this setting. Degree of insightfulness is significantly associated with a decrease in neuroticism and an increase actually in extroversion. So those are, right off the bat, those are 2 great results. This is the results of the personalities of the participants post-psilocybin treatment, okay? So a couple of things here. I have about 5 main points I want to talk about. During the 25 milligram session of psilocybin, They say the degree of insightfulness is significantly associated with a decrease in neuroticism and an increase in extroversion. So not only are they becoming less anxious, less insecure, less emotional, they are becoming more sociable, optimistic, and talkative, which is something that's huge for TRD, treatment resistant depression. Next up, we have that a spiritual experience is significantly positively correlated with an increase in extroversion from baseline to 3 months follow up. So, kind of a similar stat as the last one. However, the big part is the spiritual experience. So, spiritual experience and extroversion are positively correlated significantly. Next up, we have that the participants' openness to fantasy and openness to aesthetics were actually positively correlated with a blissful state during a psychedelic experience. Now, if you don't really know what blissful is, it can kind of get crossed here, like the definitions can get crossed. A blissful state is just an extremely happy state, full of joy, extremely happy. So, what they're saying is that if you're open to fantasy and open to aesthetics based on their data, you're more likely a blissful experience, a positive experience when dealing with psilocybin. Next up, they say that patients, this is actually kind of an interesting one. So they say while all these positive aspects, they say while these things are positive, patients with a higher neuroticism at baseline, they actually have reduced clinical improvements in neuroticism after. Even though you might not be able to change the person's insecurities or emotional states after this sort of treatment, is that they're more open to talking and more excited to talk about different things. So this could be their emotions, it could be their passions, it could be anything. They're more willing to talk than they were before, which is just phenomenal. All right, after the results, we are now on to the discussion. So the discussion is a larger section. I believe it's 5.5 pages long. And this is where they discuss the implication of the results, them kind of dissecting what they found, and kind of go into a lot of detail about the larger topic and about how these things all connect, right? Rather, okay, they cite another article, and they actually cite this guy, Costa et al. Is the name of the study, and by Costa et al. I mean ETAL. That's used when, say for example, you have 35 people who are authors on a study, and the first person's name is, Smith. You'd say Smith et al. And that kind of, those are the authors. So you cite the person's name. That's just how it's cited. A decrease in neuroticism and decrease in extroversion, facets of warmth and positive emotions, were actually found in both trials. And then the second reference is, they say that according to the same guy, Costa et al., antidepressant medication did not significantly change openness facets. So the different areas of openness, antidepressants did not change that at all. However, in this study, psilocybin actually changed openness and significantly increased. In this study, openness to actions and values significantly increased when you compare that to antidepressants, and it doesn't change openness at all, which is, honestly, it's remarkable. It's great. And they do cite, they have an interesting statement because they kind of acknowledge that there's room for interpretation here. They say that the increases, or changes rather, the significant changes in neuroticism and extroversion that they found, they don't exactly know, because it's hard to infer whether those are trait changes to personality or state changes. Different mental state, maybe something goes, like you could equate that to like something good goes on in your life and you have a different outlook on things in the moment. You kind of understand what I'm hinting at, is that it's a very short term, and they want to know if they really, really want to know if it's a trait, so it's a personality change that's there forever, or if it's something that's a state change. So this is something that they kind of infer and leave open for new investigators and new authors to kind of lead on in this area, because to them the data doesn't exactly tell them right out if these things are trait or state. Continue here to another point in the discussion. They say that after a meta-analysis, so a meta-analysis is when you do a large analysis of a whole bunch of different studies and you draw conclusions from all of those. You draw a couple of major conclusions from all of those studies that you looked at. All original, by the way, all original articles. And they said that after doing this meta-analysis, therapies, the different therapies that they, across the board, all the therapies they found didn't increase openness. Trait openness is the only trait that did not robustly change. And antidepressants don't make you more creative or curious according to Costa at all, but according to this study, psilocybin. Later part of the discussion, they do talk about how their sample size may need to be a little bit larger to grab larger implications about what this data might mean. So, for example, the larger subjects you have, the more subjects you study, the larger or the power of your statistical analysis increases because you're able to draw larger and larger conclusions from that group, something they mention here. Secondly, they do talk about the serotonin 2A receptor and how that might be responsible for the decreases in neuroticism that we see, such as things like vulnerability, anxiety, depression, and self-consciousness. So really interesting couple of sentences there, a couple of paragraphs. Obviously, I'm just picking and choosing some points that I think stand out to me. As you all know, I'm trying to make this as easily digestible as possible. Next, they get into a couple of very, very important points. They say that after a systematic study of 200 studies revealed that other therapies can change personalities. Okay, there are different therapies out there that can change your personality and are very useful for doing so. However, none as fast, as marked, and as rapid as psilocybin. Specifically psilocybin assisted psychotherapy. So this isn't psilocybin alone. This is psilocybin assisted psychotherapy. Okay? Next, they say that the assumption that personality changes over time, gradually, slowly, and subtly, this study kind of goes against all of that, is because they're already seeing changes in personality just 3 months after 25 milligrams. When you consider some of the findings they had, for example, decrease in neuroticism, increase in extroversion and openness, significant increases, and then you consider the subject group as in treatment-resistant depressed patients, you can see that this data is pretty groundbreaking as far as psilocybin-assisted therapy goes. Some of the data that's coming out on this topic is really, really interesting, really intriguing, and I do intend on kind of delving a little bit more into this subject, whether it be MDMA, LSD, psilocybin, DMT, ibogaine. A lot of these things have are beneficial for people suffering from alcoholism, cigarette addiction, substance use disorders, different things like that, as well as anxiety, depression, major depressive disorder, MDD, or TRD, as was discussed in this study. Overall, I'm really happy I went through this. I really hope you guys enjoyed this review. Tried to make it as digestible as possible. Tried to keep it all about the facts. So yeah, if you guys like this, make sure you like the video, share it with your friends, show your grandmother, and I'll see you next time. All right, peace.